So good afternoon, everyone, and welcome to today's webinar. I'm Donna Rice, the Chief Operations Officer for Diabetes Sisters. Diabetes Sisters is a member community dedicated to providing support, education, and advocacy for women living with diabetes or those at risk. Our organization offers a variety of educational resources, including monthly virtual peer support groups where women can learn and share their experiences and in managing diabetes. Our webinars are designed to inform, enlighten, and provide critical information. So please, again, if you have a question before, during the webinar, type it into the Q&A and we'll address it certainly after the talk. Today's expert series is brought to you by Eli Lilly. It's about lifestyle, and we know that lifestyle is essential for good health and always a critical element for diabetes and weight management. Our expert today is Dr. Victoria Bouhairie. Dr. Bouhairie is board certified in endocrinology, diabetes, and metabolism, as well as in lifestyle medicine. She is the founder and CEO of Perry's Wellness and Diabetes Center in Charlotte, North Carolina. In addition to her clinical practice, Dr. Bouhairie is highly engaged in community initiatives focused on healthcare improvement and population health. She serves on several committees, including the American Diabetes Association's Health Disparities and Wellness and Nutrition Committees, and has acted as the clinical advisor for the Difference in Diabetes, a DS-MES program at Humana's Centerwell Home Health. Furthermore, Dr. Bouhairie is a dedicated board member of Diabetes Sisters. Please help me welcome Dr. Bouhairie.
Thank you so much, Donna, for the warm welcome. I'm very excited to start this talk. And again, we're really going to emphasize the importance of lifestyle in relationship to weight management. And what we'll do today is define obesity as well as its medical risk. We're going to explain the epidemiology as well as determinants of obesity. We're going to understand that lifestyle is the first-line treatment for obesity and also recognize the role of lifestyle in weight management. So what is obesity and why is it important? Why are we even having this conversation? So overweight and obesity are defined as abnormal or excessive fat accumulation that really poses a risk to your health. It is defined by the WHO as obesity is defined as a body mass index above 30, and overweight is a body mass index or BMI of 25. It's important to note that for the Asian community, a BMI of 23 or above is actually considered overweight, and one above 25 is considered obesity. And the reason behind this is because the Asian community have smaller structure and a different distribution of body fat with a higher percentage of visceral fat compared to the fat that's underneath the skin. One thing that's very important to recognize is that for any BMI above 21, the chances of developing heart problems or health problems such as diabetes and other chronic disease steadily goes up. So when we talk about obesity, it is extremely common, unfortunately, here in the United States. About 42% of adults are classified as obese, again, BMI greater than 30, and nearly 70% are overweight or obese with a BMI greater than 25. Why is this even important? So in June of 2013, the American Medical Association classified obesity as a chronic disease. Initially, the thought was that obesity was related to only lifestyle. However, we have identified that obesity disrupts the normal functioning of the body. For example, the metabolism or how the body breaks down fat and carbohydrates. It changes how the body regulates hormones. There are differences in hormone production, some increase and some decrease due to increased body weight. And also there are effects on the heart as well as other chronic disease. So obesity in itself causes all these multiple different things, which can lead to problems with your health. And because of that, the American Medical Association, in addition to the American Association of Clinical Endocrinologists, have classified obesity as actually a disease. It's important to realize that there are multiple factors that play into the cause of obesity. Lifestyle definitely plays a significant role in the development of it, but there are many other things, such as food production. Unfortunately, we live in a society where food is focused on cost efficiency, as well as quantity, as opposed to the nutritional value. And also consumption. We as a society are eating more and more and more. On any corner, we see new and increased marketing for fast food restaurants. There's social and individual psychology that comes into play whenever we think about the cause of obesity. And this could be cultural norms, or it could be even individual. There could be some eating habits, such as stress eating, that can play into cause of obesity. And then there are physiological changes, as I mentioned. You have hormonal changes, you have different chemicals, we have changes in the gut microbiology that occurs with obesity, and then of course your environment. So obesity is not just one thing. It's definitely not it's your fault thing, but it is multiple different things or factors that come into play that leads to the development of obesity. One thing that we do have to recognize, and the reason for this talk, is that lifestyle does play a huge role. Mayo researchers found that fewer than 3% of the Americans do not live a healthy lifestyle. So what that means is less than 3% do not get the needed exercise, which is defined as at least 150 minutes of moderate or vigorous exercise a week. Or scoring in the top 40% of eating healthy index. And really what that means is a diet that is recommended, and having a body percentage below 20 for men or 30% for women, and not smoking. So less than 3% of Americans are not living a healthy life. When we talk about what we eat, we have 80% of Americans are not getting the vegetables that they need, and more than 70% are not getting fruits that they need. We have around 50% of American adults that drink sugary beverage every single day, and more Americans consume solid fats, added sugars, and sodium that is currently recommended. So we definitely do have a lifestyle problem here in the United States. And the reason why this is important is because obesity is tied to many chronic disease. The condition most strongly influenced by body weight is type 2 diabetes. And what we've seen is that compared to individuals with normal BMI, men who have a BMI of 30 or higher have a 7-fold increased risk of developing type 2 diabetes. And for women, those with a BMI greater than 30 have a 12-fold increased risk of developing diabetes. So you might ask why? What is going on? And the reason why this is the fat cells, particularly those around the waist, release hormones and other substances, we call them neurotransmitters, that increase inflammation. Now, this inflammation decreases insulin sensitivity. It alters the way in which the body metabolizes or breaks down fats and carbohydrates. And this leads to higher blood sugar, in addition to the development of diabetes and its complications. The excess fat also deposits into the liver as well as your muscle, and that can cause insulin resistance. Not only is obesity associated with type 2 diabetes, but also increases your risk of having heart disease. For those who are considered BMI greater than 30 or obese, have an 81% higher risk of having heart disease compared to those with a normal BMI. Your stroke risk also increases. Someone with obesity has an increased risk of stroke up to 60% compared to one that have a normal BMI. So when we talk about weight management or weight loss, as clinicians, what we've seen is that a 5% reduction in body weight is actually clinically significant. It makes a huge impact. So when we're developing goals, we really aim at least 5%. And this chart here shows you the multiple benefits, which is an abundance amount of benefits when you do lose at least 5%. So from type 2 diabetes, where you have a reduction in your A1C, you can reduce the use of medications. And also we've seen that it could be diabetes remission with weight loss. If you have high cholesterol, you can have lower triglycerides, an increase in HDL. That HDL is your good cholesterol, and also a decrease in your LDL, which is your bad cholesterol. And PCOS, I know multiple women have PCOS, and that 5% weight loss can cause an increase in fertility. It reduces hirsutism, which is basically increase or excess hair, and also decrease your androgen levels, such as testosterone, and also increase insulin sensitivity. So again, that 5% weight loss has a multiple amount of health benefits. Another thing that we've seen is that losing between 9 kilograms to 13 kilograms intentionally can lower the risk of death by early death by 25%. So currently within the healthcare system, we really are treating the cause of we're treating the symptoms and we're treating the disease itself. But we really need to focus on the cause. We really need to see if we can really turn off that leaky faucet. What's causing this chronic disease and what's causing, in this case, obesity? We really need to focus on that. So lifestyle medicine is actually a medical specialty that focuses on the use of lifestyle changes as the primary treatment to prevent and manage chronic disease, such as obesity. And it's actually a very powerful tool for transforming health by making these everyday changes. And the focus on healthy eating, stress management, minimizing risky substances, exercise, restorative sleep, and social connections all together come in addition with medications if needed, really becomes individualized, but really gives you that empowerment to prevent and treat chronic disease. So Hippocrates says, our food should be our medicine and our medicine should be our food. I get this question a lot, which is what type of diet, which I don't like to use, so we're going to use nutrition plan, but what type is the most beneficial or does it matter? There was a study that looked at 4 low-calorie diets with different distributions of fat, protein, and carbohydrates. And throughout the study or throughout the groups, the feeling of being full, hunger, and satisfaction of the diet were all comparable between the groups. And what they saw is that there was actually no significant weight loss between the diets of varying macronutrients. So what that means is that if you adapt any type of diet or nutrition plan, there will be some type of weight loss as long as you're decreasing calories. What they did see among the different groups is that regular attendance to the group sessions was closely linked to the amount of weight loss. So what that means is that within different types of nutrition plans, having some type of accountability group or network, having peer support was actually closely linked to weight loss. To emphasize here is that you can lose weight by calorie reduction. I do want to emphasize that within different nutrition plans, there are additional benefits. So the Mediterranean diet is one. This is a diet that focuses on whole grains, fruits, vegetables, legumes, nuts, and healthy fats, food, and seafood. In addition to weight loss, what we've seen with the Mediterranean diet is a 30% lower risk of experiencing new cardiovascular events. And that means new heart attacks, or the need for stents, etc. There's also 40% lower risk of developing type 2 diabetes and up to 70% lower risk of having another heart problem, such as a heart attack. So the Mediterranean diet is a very robust diet. I love it because it's versatile. It also gives you multiple options. It causes weight loss, but it also gives you all these great health benefits. Another nutrition plan, whole food plant-based diet, that's actually becoming extremely common now. This focuses on a single ingredient, unprocessed or minimally processed nutrition source. Plant-based means that 95% of your calories comes from plant sources, such as fruits, vegetables, whole grains, and legumes. And with this one, I always tell my patients that you don't have to be a vegetarian, right? But the more plants you eat, the better. But for the whole food plant-based nutrition, there again are multiple benefits. In addition to weight loss, it protects your heart, it lowers your bad cholesterol, improves your blood sugars, and also reduces the risk of diabetes as well as certain cancers such as breast cancer, prostate cancer, colorectal cancer, and lung cancer. So how do we approach nutrition changes? So again, there's no answer that fits all, right? It's not a one in all type of answer. However, in general, we really want to individualize and really take what applies to you and what works for you. But I would say start slow. So begin eating or making healthy changes by making small changes, such as trying a new vegetable each week. Go to local farmer markets and see if there's anything new, or have an increased amount of vegetables inside the fridge. You can say for breakfast this week, I'm going to do more whole grains as opposed to the simple carbs. You also want to make sure that you are drinking more water. As you know, the recommended amount of water for a healthy adult is 64 ounces. So if you're somebody that likes to have a lot of sugary beverages throughout the day, just try and minimize that and see if you can replace it with water. There are a lot of people that would have, if they like flavor, will just put either a cucumber or a lemon or something just to add some flavor to it. You also want to avoid ultra-processed foods. Now, these ultra-processed foods are those that have a very long shelf life. So you have your chips, your crackers, things that are heavy in artificial flavor and colors. These, if that's something that you tend to do, you can say, for example, for one snack throughout the day, I'm going to replace it with something that's more healthy, such as carrots and hummus, for example. And you also want to incorporate more plant-based foods. So if, for example, you have a plate full of food, you're going to give yourself an extra scoop of a plant-based food and then maybe decrease an animal product. And also planning ahead helps. So if you meal prep, you get to really have a more conscious and mindful decision as to what you want to do or what you want to eat throughout the week. And then there's no chance of you planning something on the spot and maybe making unhealthy health choices. When it comes to physical activity, As we can all suspect, the NHACE study showed that low levels of physical activity and recreation are closely linked to weight gain. The Nurses' Health studies show that every additional 2 hours you spend watching TV is associated with a 23% higher risk of obesity. The current recommendation is to have at least 150 minutes per week of moderate intensity activity, such as brisk walking, or 75 minutes of vigorous intensity activity, such as hiking, jogging, and running. You also want to have muscle strengthening activity at least 2 days a week. And it's very important, especially post-COVID, that we watch how many hours we're sitting in a day. There are many people that are working remotely that ties us to a computer, but we have to be mindful about that prolonged sitting. Researchers have shown that sitting more than 8 hours a day without any physical activity had a risk of dying similar to that opposed by obesity by itself and smoking. So it's a very, very important. And fortunately, we have many apps now that can help you or remind you to get up and start walking around. I put this in here so that you can have an indication as to what that moderate and vigorous activity means. So as I mentioned, the current recommendation is 150 minutes of exercise a week. So a way in which you can determine if you are doing that is what's called the talk test. So for moderate activity, your breathing is fast and you can carry a conversation, but you cannot sing. When it comes to vigorous activity, you are really grasping for air. So that's your jogging, you're dancing. And in this type of activity, you cannot hold a conversation. So for moderate activity, we want 150 minutes a week. And for vigorous activity, we want 75 minutes a week. Now, this slide is extremely important. And what I want to emphasize is weight maintenance. So if you lose weight, what can we do? Or what are some of the things that we can do to help to maintain? What this study showed that at 6 months after losing weight, there was the group that had the highest amount of weight maintenance that were able to maintain their weight was those that actually had the most amount of physical activity a week. So in this triangle group, they had more than 30 minutes of physical activity a week. As you can tell, between all of the groups, there was a degree of weight loss, but those that had the most physical activity per week actually lost the most weight. So when it comes to actually maintaining weight, the American College of Sports Medicine recommends that you need to engage in physical activity for 60 minutes a day. The U.S. National Weight Control Registry shows that, or highlights that it is crucial that you exercise 60 to 90 minutes a day. If you remember, I mentioned that you should exercise 150 minutes a week in order for you to lose weight. So why all of a sudden are we saying we have to exercise actually more to maintain weight? The reason why this is the case is for every 10% reduction in body weight, it results in a 20 to 25 decrease in what we call total energy expenditure. And what that refers to is the total amount of energy that an individual uses throughout the day. It really encompasses all the energy expended through various body functions and activities. So because of this decrease in total energy expenditure, for you to maintain the same body weight after losing 10 pounds, you have to consume 300 to 400 fewer calories per day compared to somebody who has not lost any day. And this reduced calorie requirement can persist for several months to years after you lose weight. And the reason why this happens is called metabolic adaptation. And what that means is as you lose weight, your body just becomes more efficient. The skeletal muscles can do the exact same thing that it used to do, but this time with the weight loss, it requires a lot less energy. So your skeletal muscles, which are the muscles used for you to walk around and for exercise, is 20% more efficient with weight loss. And then your non-resting energy expenditure, which is the energy that you expend doing any activity, drops by 30% after weight loss. So and essentially your body becomes more efficient and your energy expenditure decreases as you lose weight. So you really have to be mindful once you lose weight to make additional adjustments to help to maintain that weight loss. So when I mentioned that your resting energy expenditure decreases, this study showed that at 6 months, among various degrees of diets, there was a decrease in the resting energy expenditure, and eventually it did come back to baseline, but it took up to 2 years. So a lot of the times, people will struggle with maintaining that weight, but this is one of the reasons why that resting energy expenditure has decreased. So the body again has become more efficient, and that effect can linger for up to 2 years. So what can we do in order to help increase the amount of exercise that we are doing? I always say start small and build gradually. So begin with something that's manageable for you. Again, not one size fits all, what works for you. And gradually increase the duration and intensity. If your goal is 150 minutes a week, you could probably start with 60 minutes a week and then have a plan in place in order to build that. You want to set a specific and achievable goals. If some of you have heard these SMART goals, so that's specific, is measurable, achievable, it's relevant, and it's time bound. So you really want to make sure that your goals are very specific and again, very realistic for you in order for you to make it work and for you to be motivated. It is also good if you schedule it like it's an appointment. So if you have told yourself that at 8 o'clock on Monday, Wednesday, and Fridays, I'm going to exercise, then try to make that non-negotiable. Don't make appointments during that times. Just leave your schedule open because what you've told yourself that this is a time that works well for me and I'm going to stick with it. Also find activities that you enjoy. This could be Zumba class. It could be just dancing at home. And also any physical activity is a step in the right direction. And also if you find something that you enjoy, you realize that you will continue to do it. It doesn't really feel like it's a task, but something that you will enjoy doing. Have fun. Go for walks with friends or family. Make it something that you will enjoy. Also track your progress and reward yourself. Let's say for the first week, you're able to reach your goal. Do something fun with family or friends. Have something that you look forward to. And also you can have an accountability partner. Just something regardless in all of these things, again, make it individualized and make it fun because the key is to make a lifestyle change. How about sleep? We have over 40% of adults reporting getting less than 7 hours of sleep in a 24-hour period. We know that adults need 7 to 8 hours of sleep each night. And if you consistently get less than 6 hours of sleep, that increases the risk of death by about 10 to 12%. And lack of sleep is linked to chronic diseases such as heart disease, diabetes, high blood pressure, depression, and of course, obesity. There's also current evidence that says that if you don't sleep well, it's actually harder to lose weight and to maintain the weight loss. The reason why this is, if you remember, I mentioned that there are various chemicals that are involved when it comes to obesity. One is called leptin. Your leptin is the hormone that helps you or tells your body that you're full, let's not eat anymore. And ghrelin is the hormone that tells your body to eat. What we've seen is that with sleep loss, leptin actually decreases. So that hormone that helps you to stop eating and hormone that helps with satiety decreases. But ghrelin, that hormone that makes you want to eat, increases. So you have a lot of physiological changes or hormonal changes that occur with sleep deprivation that makes you want to eat more, and that contributes to obesity. What we've also seen is that with sleep loss, there's a decrease in insulin sensitivity, and this will result in glucose intolerance as well as increased risk of diabetes. So when it comes to sleep, you really want to try and make sure that you have a regular sleep schedule and try as much as possible to be consistent, even on weekends. If you've ever had to train infants or kids when it comes to a regular schedule, one thing that is always emphasized is consistency, and the same applies with us. If if you tell yourself, for example, at 10 p.m., I'm going to go to sleep, eventually your body will learn that at 10 p.m., it's time for me to shut down and go to sleep. You also want to ensure that your bedroom is quiet, it's dark, it's relaxing, then a comfortable temperature. Studies have shown that lower temperatures tend to help sleep a little bit more than the higher temperatures. But again, what works more for you? You want to keep devices out of the bedroom as much as possible. I always tell my patients to just don't put your cell phone next to your bed. Put it in another room so that number one, you're not tempted to go on it as you're going to sleep. You're also not tempted to go on it if you wake up in the middle of the night. You also want to avoid heavy meals, caffeine, and alcohol right before bedtime. And staying active with physical activity during the day helps you fall asleep easier at night. Social connections, and I really love this topic here. Spending time with friends and family is extremely important. In fact, it's the strongest factor when it is one of the strongest factors in predicting how long we live. Our social factors really help to prevent the development of loneliness and isolation, which can lead to depression and anxiety. Now, why does this matter when it comes to obesity? What we've seen from a 2010 study is that depression can lead to weight gain and obesity, which in turn can worsen depression, and this causes a vicious cycle. So individuals with obesity in this study had a 55% higher risk of developing depression, and those who were depressed at the beginning of the study had a 58% higher risk of developing obesity. Harvard conducted a 75-year study looking at almost 270 Harvard-educated men. And what they found is that there was a strong relationship between social connections and our well-being, having supportive relationships. And I'll tell you, Diabetes Sisters in its peer support actually is one of those great social connections that you can have that studies have shown improves your well-being, helps you handle stress, and also helps to give you that accountability piece that we talked about earlier. So ways in which you can increase your social connections. You can join a club, find something that you are interested in. It could be a book club. It can be, for example, if you love hiking or if you love nature, it could be a hiking group, cooking class if you're somebody that loves to cook. Also, things that you're passionate in, volunteer. You'll find like-minded people there that you can develop very strong relationships with. You want to stay connected, and this could be in various forms. It could be a religious or church setting. Stay connected with your friends and family, and also attend events. It could be networking events. It could be a local festival or workshops and seminars, things that you're interested in. But again, the peer support group for Diabetes Sisters is another great one with their different meetups. So there are multiple ways in which you can increase social connections. And again, this provides robust benefits when it comes to your health. So I cannot emphasize what stress does to us. There's a hormone called cortisol that's released whenever we're stressed, and this affects metabolism or your body's ability to break down various types of nutrients. And it affects the ability for your body to efficiently store different types of micronutrients. And this can lead to diabetes, insulin resistance, etc. High stress also high stress levels have also shown to decrease even your motivation to want to maintain or to develop some type of lifestyle change. Individuals that have had a higher cortisol level are more likely to develop diabetes, as I mentioned, and especially around that mid abdominal area, or what we call the visceral fat, which tends to have a higher link to chronic diseases. And also, obesity is more likely to persist over time in people that have the higher amount of cortisol levels. So, if you are not managing your stress appropriately, that can really hinder your ability for you to lose weight and maintain weight loss. Some ways in which we can do it are, again, maintain healthy eating, avoid social isolation. You also want to, have your social group, people they can talk to, accountability people, rest and sleep well. You want to be express or even engage in gratitude. I always have my patients and also my family, we all have our gratuity journals that we do every single day. Take deep breaths and really be present. Here I say stay informed, but not obsessed. Just take things one day at a time. Nature is a great way to decrease stress. It can enhance your mood, increase feelings of relaxation and happiness. And also, nature by itself provides a calming effect that helps to uplift your mood and decrease feelings of depression. This study it's called the Look Ahead study. And what they did was they had a group of people and they gave them intensive lifestyle therapy. And as you can see, there was a robust decrease in weight. And also, up to 65% of these individuals that continued the lifestyle behavior were able to maintain at least a 5% weight loss after 8 years. The emphasis here is that lifestyle is first-line medicine. The Center of Medicare and Medicaid Services concluded that intensive behavioral therapy is effective and necessary for preventing illnesses or early disability. So what we're saying is that lifestyle is the foundation. We really can't do without it. And I'll even emphasize that even with the development of the GLP-1 drugs or the GIPs, such as Zepbound, there is indication that you must take these medications in addition to lifestyle changes, such as reduced calorie diets or changes in your nutrition plan and increase physical activity. So throughout all aspects of treatments, you really want to make that lifestyle change the foundation of what you are doing. I want to conclude by saying embracing lifestyle as medicine isn't just about making isolated changes. We really want to make sure that we're taking care of ourselves in a very holistic approach using all those 6 pillars. By focusing on those, not only are you reducing the risk of developing chronic disease, but can also manage chronic disease. I want to emphasize that small steps towards healthy lifestyle is the way to go. Make sure that you're making it individualized. Make sure that you are having help, accountability partners, peer support groups such as Diabetes Sisters. Have clinicians that you trust that can help you make these changes and help you to prevent chronic diseases in addition to obesity. That's all I have for you today.
But Dr. Bouhairie has also put together a really good tip sheet And you could get that as a downloadable from our website. And it really touches on so many of the things she talked about, because there were so many great messages in what she said. And, you know, when you think about it, I think sometimes we all look for that magic pill or whatever, but the foundation is really lifestyle. And it was really disheartening for me to hear about like only 3% of people have really embraced. That means 97% of people really need education and awareness and really help and support and really like, and, you know, really embracing some of these lifestyle ideas you had. So one of the things we'd like to do now is kind of go to the Q&A, and I see that we've had a couple of questions that came in from our viewers. If you have a question, go ahead and put it into the Q&A. Our first question comes from Mary Kay in Ohio, and how can I ensure I'm getting enough vitamins and minerals? And should I take supplements?
Yeah, so I would tell you that again, individualized, but with a whole food plant-based diet, besides vitamin B12, it really does supply all of the vitamins and supplements that you would need. Um, and if you really don't have any limitations when it comes to your diet, having a variety of foods, so really embracing all colors, that could be the fruits and vegetables. Evidence have shown that you really don't need any additional vitamins or supplements as long as you're having that variety of food present.
Very good. So we have a question that comes from a Rachel and from Wyoming. And she said, thank you for the presentation. Can you tell me the amount of carbs I should consume daily?
Yeah, so again, that's individualized. The carbohydrates, the recommendation currently is 130 grams of carbohydrates. So again, it really depends on what you're doing. Is this prevention? Is this treatment of diabetes? Then that would differ. But again, 130 grams of carbs.
Very good. Another question from Deborah. My doctor told me to take 10,000 units of vitamin D because my vitamin D level is 27. I am nervous about taking so much. What are your thoughts?
So how much was she taking?
10,000 units.
Yeah, so 10,000 units is in the greater, if we look at it on a greater scale, is not considered a high amount of vitamin D. Some people take up to 50,000 units weekly. 10,000 units a day, 70,000 can be needed if your vitamin D levels are low. I wouldn't be concerned of vitamin D overdose. Vitamin D is essential. And of course, work with your provider. If your vitamin D levels are more than 30, then you can consider decreasing that amount of vitamin D. But yeah, I definitely have seen people take, we have prescribed a higher amount of vitamin D supplements or medications. So definitely go ahead and take that according to recommendations, and go back and discuss if you should decrease the amount after you have follow-up blood work.
Very good. And a question from Deborah. Do you do a telemedicine visit if I wanted to see you once in order to evaluate how I can best lose weight?
Yeah, I do. So you can just go to my website, www.perryswellness.com, and we can schedule something for you.
Very good. And let's see here. Hang on. I think we have one more question. How do I stay motivated to maintain healthy habits long term? This is from an anonymous sender.
Yeah, I actually really love that question. And it's one of the things that I recommended during the talk, which is that social support, really having that peer support. And again, that's one thing that Diabetes Sisters offer, or having some type of accountability partner. It could be a friend, it could be family, but somebody that you know is going to be a source of support as you're going through the journey. Any change in life is not easy, but having somebody that's going to help motivate you, lift you up when things are tough, be that phone call whenever you need it, is very, very important. So definitely friends, family, just have somebody there that supports you and can surround you and help you through the journey.
Good points. And the last question comes from Linda Lee. How can I lose weight safely with diabetes?
Again, so it really is individualized, but the 6 pillars that I spoke about, definitely use those. As I mentioned, from that look ahead study, having lifestyle changes can decrease your weight by 10%. So just making sure that your nutrition plan, you have a goal in place for it, be it the Mediterranean diet or be a plant-forward, whole food, plant-based diet, which causes that weight loss in addition to other health benefits. You want to make sure you're getting the physical activity in. I do want to emphasize that physical activity without the associated reduced calorie intake has a very minimal effect on weight loss. So you want to make sure that you're doing both. So physical activity plus decreasing the calories, and decreasing those calories, choose healthier calories. We talked about the sleep, making sure that you're sleeping well, social connections, stress reduction. And then one thing that another pillar was substance abuse. So making sure that you have healthy ways of dealing with stress that doesn't affect your health, such as smoking or excessive alcohol use.
Very good. And for those with those questions too, your tip sheet I think could be really helpful as well. So go to our website, download the tip sheet because it really summarizes a lot of those areas that really encompass that whole area of lifestyle medicine. So thank you, Dr. Bouhairie. It was a wonderful presentation. We really appreciated it. So again, a big thank you to Dr. Bouhairie, a big thanks to Eli Lilly, who's without their unending support and sponsorship, we could never be doing great programs like this. And for all of you out there, thank you for joining, and we hope to see you soon. Bye-bye.
Bye-bye.